So I want to switch gears just a little bit and talk about the correction that came out to the
Oh, yes,
paper.
yes.
So first, I want to congratulate you for getting it out so quickly and for addressing the
Yes.
comments head on. But if you could summarize for us kind of some of the things that you brought up in the correction, and if you think they have any impact on the conclusions or the findings.
So in principle, no. In principle, the correction was very embarrassingly a bit of a cleanup. And the first obviously submission went through very fast. It was a fast track submission, and perhaps if you check any other fast track submissions, they all have a little correction here and there. So we were obviously spotted to have two typos which were very well brought up, and we corrected that. And at the same time, we also benefited from the statistical reviewer, which is something that normally happens when you submit a scientific publication. It didn't happen this time around because it was a fast-track publication. So we said, fantastic, let's just do it properly. And through that, there were a few suggestions how to make the presentation better, how to make it more consistent throughout the paper. And that's why the paper has changed perhaps a little bit more in presentation, but actually all the content has remained the same. So we were quite reassured about that, because we obviously didn't want to confuse anyone. So there was one change, and that was also one of the typos. This is in with regards to the LV mass. So actually what came out, surprisingly, is that COVID patients have lower mass compared to controls, which was something that obviously was misplaced finding, and it didn't make sense the first time around. And obviously when we checked all the data throughout again, we realized that this somehow went the wrong way. There.
So Dr. Poopman, we've talked about a lot of stuff today. I want you to summarize the top 2 or 3 takeaways for the average clinician who sees a patient after COVID.
Fantastic, thank you so much. So first of all, I have learned so much through this experience with my patients, also because we were able to learn about the long COVID symptoms that they perhaps even themselves didn't want to believe they have. They just wanted to put the whole thing behind them. And many of them actually came back another time and another time and said, actually, I cannot get fit. And they were really sportive. Quite a few of these patients actually got their infection on skiing holidays. So very sporty, active people, and they simply couldn't get fit. And it took them a while to actually come to terms. Maybe I just need to do it a bit slower. And I think this is a huge message, especially to the young people that will get infected, partially because we all need to get on with our lives. We need to keep on working. We need to somehow get on with it, and we will get infected sooner or later. We need to give the heart time to heal. Very important. I'm not saying that they shouldn't do any exercise at all, but I would want them to really put it on a low burner. So really slowly, and listen to themselves, because this improvement also happens on a day 1, and then maybe on a day 2 and 3, actually they feel worse again. It fluctuates. It's a normal thing. It's a normal post-COVID recovery thing. Just take your time. Give yourself a chance to heal. So that's maybe my most important message.
Perfect. And then you might have heard yesterday, the Big Ten made an announcement that 15% of their athletes showed signs of myocarditis by cardiac MRI, with all or most of them having mild or no symptoms at all. So yeah, clearly your publication has had a huge impact. Can you comment really quick on abstaining from sports participation based on these MRI findings?
Thank you so much. It is a very difficult thing, and obviously we were bombarded by this exact question, and we were going a little bit, actually, we haven't had a single athlete, professional athlete in our cohort. We really cannot comment on it. But in principle, common sense applies. Professional athletes, they expose themselves to the levels of stress, to the levels of exertion that is beyond human. Let's just be honest. Let's just take this as a baseline. And obviously, this is something that on a heart that is perhaps a little bit inflamed, that needs time to heal. So myocarditis is inflammation, but there is still the damage underneath, like infarction, but perhaps in a more diffuse manner, but the damage is still there. And with infarction, we also don't say to the patients, go and train immediately.
Right.
We ask them to actually take it easy for a good 6 months. And I think this should be perhaps the guiding point as well, especially because we are so early and we know very little, and we just need to take it easy. And unfortunately, this applies also to professional sportsmen. I'm not saying that I know much about it.
Any concluding thoughts, and what are the next research questions you're going to ask?
Good question. So we definitely need to offer cardiac MRI to many more people. And we also need to be very efficient how we go about this. So this is not scans that last hours and hours. Please do not do that to the people. Max 30 minutes. This is for us an absolute limit, and we definitely do not want to expose patients to lying in a scanner in a tunnel for more than that, because it's just really a huge effort. So if we can improve our practice, how we do imaging, how we do cardiac MRI, I would be really delighted. So this is perhaps the first thing. The other thing is that everything we do has to have a consequence, has to have a therapeutic consequence. And we need to link our imaging with therapy. We are preparing a clinical trial. This is absolutely the next thing that should be done based on what we have learned so far. And we are hoping by being there earlier, by understanding the pathophysiology of disease a little bit better, that we're going to be able to at least offer proper cardioprotection and not heart failure therapy to many more people that actually would probably end up in a heart failure without it. So this is our aim, our hope, and we are working hard to deliver that.
Dr. Putman, I want to thank you so much, not just for your valuable scientific contribution that I think has really made an impact in our understanding of this virus, but also for your time today, all of your insights. Thank you so much for joining us.
My pleasure, and thank you so much as well for giving me the time to speak. Thank you.